Hey, what's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at HAIRLICIOUSLY.com to purchase your microneedle device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo and serum, hair growth vitamins, and a few other products to help those who are losing hair. So in today's video, I wanted to share with you some before and after results of patients who have been using finasteride and or minoxidil for the treatment of androgenic alopecia. As you guys know, these are two FDA-approved medications for the treatment of hair loss in the US, and the majority of users have been able to either maintain or see some moderate regrowth. Depending on the study that you guys are referencing, typically about 80 to 85% of finasteride users are able to halt or slow down further progression of hair loss, and about 60% are able to see moderate hair growth. The 5-alpha reductase inhibitor finasteride blocks the conversion of testosterone to DHT, the androgen that is responsible for male pattern baldness in genetically predisposed men. Now, minoxidil, on the other hand, acts as a growth stimulant and prolongs the anagen phase of the hair cycle. It also increases the hair follicle size. So for the past couple of decades, the combination of these two have basically been the main arsenal in fighting hair loss. I think that it's important to visually see why taking finasteride and minoxidil is recommended, especially for those who are just starting to experience hair loss. Because the longer that you guys wait, the more hairs you are going to lose and the more difficult it is to regain all of the lost hairs. If you guys start early on, there is a good probability that you'll be able to slow down further progression of hair loss and even halt the progression of hair loss and maintain what you have while potentially being able to regain some of the hairs. For some individuals, they were able to reverse the majority of their hair loss with just medication. So they were lucky enough to kind of skip going through a hair transplant. So I found a bunch of before and after photos from Dr. Bernstein's website. I'll be leaving the link in the description box below. But he's been a hair transplant doctor for the longest time in the industry. And so if you guys want to check out some more before and after results, make sure to check out his website. The examples that I'm about to share with you guys of patients are obviously people who've had positive results with finasteride and or minoxidil. They are using the said treatments individually or in combination to treat their hair loss. I have to also point out that they did not get a hair transplant, and as you'll see in the results of the medications are going to vary from person to person. For some individuals, it's going to appear as if they did not see any positive results, but at the very least, they were able to maintain what they had. And the most important thing for finasteride is that it stabilizes hair loss. If you do see regrowth, that's more of like an added bonus, and this is why a lot of people also incorporate minoxidil since it acts as a growth stimulant. So this first guy we see here, he is a 39-year-old male before treatment, and for somebody who is under 40, we can see a lot of diffuse hair loss going on in the mid-scalp and also the frontal portion of the hairline. And it seems like he's kind of like trying to cover some of the area in the back here, so I'm assuming that he does have hair loss in the vertex area as well. And then 19 months on finasteride, 1 milligram per day. So almost 2 years after being on finasteride, he is literally able to reverse hair loss. We now see a well-established hairline, and the mid-scalp that was once void of hair is now just filled in with density. The thing is that this guy was just on finasteride, which is pretty crazy to see, you know, stabilization of hair loss in addition to new regrowth. And I feel like if you were to also incorporate something like minoxidil, microneedling, laser therapy, he's going to be able to kind of fill in that density even more. And this guy's lucky enough to the point where, you know, a hair transplant wouldn't be warranted anymore just because he saw some pretty good growth. This guy is a pretty, I would consider him to be a hyper responder to finasteride. So pretty good results. Now this next guy, I'm assuming he is maybe of Asian descent given his skin complexion. But he is a 20-year-old male before treatment. So 20 years old, he has some pretty aggressive hair loss going on. And I'm pretty sure that without treatment, this guy would probably end up like a northward 6, northward 7. And it looks like he's well on his way. A lot of thinning on the mid-scalp. There's no hairline that's actually intact. And then 1 year on finasteride, 1.67 milligrams per day. So he is taking Prosker, which is a 5 milligram version of finasteride taken for benign hyperplasia. And the thing that I don't really like about this one is that his hair has been growing out, and it's kind of hard to compare it with his before photo. But it seems like even like some of these areas here, if you compare it to the one on the after photo, it seems like there is improvement to the density, and just kind of like the overall condition of the hair looks pretty good. His result isn't obviously drastic as the one before, But after 1 year on finasteride, he is able to stabilize hair loss because we don't see any progression of hair loss. But this guy very likely is going to, I feel like, is going to need a hair transplant to really add in density and to reestablish a hairline. But at least he is responding to finasteride, and not everyone is going to be a responder given the fact that he is able to at least stabilize hair loss, which is kind of like the main goal for using finasteride, 5-alpha reductase inhibitor. I think he is pretty good. He should also, like I said, throw in minoxidil, microneedling, maybe an anti-androgen to see if he's going to be responding well. But overall, he is a responder in terms of just stabilizing hair loss. So, nothing special here. This next guy is a Caucasian 34-year-old male before treatment. We can see some pretty heavy hair loss going on just to the frontal portion and the mid-scalp. We actually don't really see a hairline going on. And after 5 years on finasteride, 1.25 milligrams per day, and he's also using Rogaine, minoxidil solution 5%. So I'm assuming that he didn't have any side effects, or he had very minimal side effects since he was on 5 years of finasteride. And he's seen some pretty good regrowth. We see this kind of like this mold thing right here. And over here we see actual hair regrowth, like right above it. So minoxidil and finasteride is working pretty well in terms of regrowth. But he's not really seeing anything crazy in terms of density. So I feel like despite the fact that he's had a pretty good result, he can resort to a hair transplant to add more density, thicken up the hairline, and then get a more well-established hairline, but pretty good results from where he came from. And I feel like he's been able to save at least a few $1,000s in terms of grafts just because of the regrowth potential that we see here. The next patient is 44 years old before treatment. We can see him in that little, the man bun. And it seems like he's doing that. A lot of people do that, especially if they're kind of like losing hair, just so that they can kind of cover up some of the areas that they're thinning and miniaturizing. And then this is a pretty good after, transformation, 3 years on finasteride, 1.25 milligrams per day, and also minoxidil solution 5%. He has a more well-established hairline now. And there's also a lot of good density that has thickened up on the frontal region and the mid-scalp. And overall, pretty good results. And I think this guy would be pretty content with how his hairline and his regrowth has been. And if I were him, I probably wouldn't even look into a hair transplant. Next guy, 29-year-old male before treatment. We can see a lot of diffuse thinning. It's kind of like sporadic hair loss going on. 13 months on finasteride, 1.25 milligrams per day. And minoxidil solution 5%. We can see some pretty good regrowth. I also kind of don't like this because the hairs have been grown out and it's kind of difficult to compare his before and after photos, especially when the hair lengths are different. But if he were to kind of like regrow his hair to the point of, his after results, I don't think he would be able to get this kind of result just because of the fact that there's a lot of thinning and like balding spots that we can visualize here. At the very minimum, he is able to stabilize hair loss and see some growth due to minoxidil. Next result is a 45-year-old male before treatment. We can see some frontal recession for this African-American. His 2 years on finasteride, 1.67, so he's also using Prosker, breaking it up into thirds, and then Rogaine, solution 5%. He really hasn't seen that much of a difference, but we can kind of tell that the mid-scalp area is slightly better, but that also might be due to lighting. But after 2 years, he really hasn't seen much progression of hair loss. So as far as stabilization is concerned, I think finasteride is working. He can also, like I said, throw in microneedling to see if that's going to help. But after 2 years, he's probably going to need a hair transplant if he wants to get a more well-established hairline. And in this case, it is going to be a pretty easy job just because of the fact that he does have an advantage being African-American or having curly hair. It's going to be able to cover more surface area with fewer grafts just because of the curly nature of the hair. But overall, it is a pretty good transformation, I think. This next guy, 28-year-old male before treatment. We can see a lot of thinning going on, diffuse pattern hair loss. The hairline is also very weak. And then 3 years, 3 months on finasteride, 1.25 milligrams per day. And then minoxidil 5%. So he's actually seen some pretty good regrowth, right? So you can't really achieve a result like this in terms of growth and density from something of this nature before his treatment. And there's a lot of good coverage. Like you wouldn't even be able to tell that he's actually had hair loss initially prior to him taking finasteride and minoxidil. But he's seen some pretty good results, and you know, it would have been nice if we were able to kind of see the hairline, just kind of see exactly how it's been progressing. But he kind of put his hair down, we can't really tell. But I'm assuming that there also has been improvement to density to the frontal portion of the hairline as well, just because of the fact that he's been able to cover parts of his scalp and his forehead. So pretty good results. Next guy is another case of an African-American, 29-year-old male before treatment. We can see kind of like that distinct hair loss pattern on the frontal portion, and that kind of like island portion that's kind of left, probably like in the word 4, maybe in the word 5, V. Or actually not a V, because I don't think he has any vertex hair loss going on. But 4.5 years on 1.25 milligram of finasteride per day, Rogaine solution 5%. And there was a pretty good improvement. We can now see his hairline where we previously couldn't see here. He had more of that recession going on the hairline, and it's just now just been filled with hair. And you know, he's another case of a pretty good result. Next patient, 30-year-old male before treatment. We can see a pretty diffuse pattern hair loss on the mid scalp, frontal portion, and also parts in the vertex. And then after 13 months of finasteride, 1 milligram per day in Rogaine solution, 5%, we can kind of see, you know, a little bit more thickening. This case is not drastic like some of the other ones that we've seen, but I think in his case also it's more of just the fact that he's been able to stabilize hair loss for the past 13 months. And, you know, if you kind of look at this area here, it seems like his hair is slightly longer, but it also looks like it's also been kind of thickened up as well, thanks to finasteride and minoxidil. Mediocre results, I would say. And this guy would most likely also need a hair transplant if he wanted to obviously add more density to the hairline and parts of the mid scalp. Next guy, 25-year-old male before treatment. A lot of frontal recession going on, also the mid scalp. It's kind of like you're left with that island portion, and then as the hair loss progresses, it's going to kind of slowly reach the vertex. And then 1 year on finasteride, 1.25 milligrams per day, and minoxidil solution 5%. There's obviously a lot more coverage, but it's not really helpful for us just because of the fact that some of his hairs are kind of covering the potential areas that might have seen regrowth. It looks like he doesn't have any further progression of hair loss. It would have been nice if he kind of were able to kind of part that hair so that it's kind of like how it was before. But it seems like his hair is growing out pretty well. And you know, this guy's also probably going to need a hair transplant later down the road if he wants to get a more established hairline. 25-year-old male before treatment. We can see a lot of some moderate hair loss going on for somebody who is 25 years old, and also the temporal points here that's been receding. And 12 months on finasteride, 1.25 milligrams. He's actually been able to kind of regrow all of that hair there on the mid scalp. And it looks like some of the temple regions also was able to see some hair, but you know, the fact that he's kind of covering his hairline as well in some of the prior examples that we've seen makes it a little bit difficult to kind of assess how much potential in terms of regrowth that he's been seeing. But you know, he has been able to kind of regrow some of the areas here, and that's why he's been able to cover it here. Whereas before, he has a lot more thinning and miniaturizing areas that were not able to be covered with hair. Next guy, 30-year-old male before treatment. And we can see some significant hair loss going on the mid scalp, and also parts in the hairline where it looks pretty weak with miniaturized hairs. And then 1 year on finasteride, 1 milligram, we can see a somewhat improved hairline. In terms of density, I don't think it's much different from how it was before, but just the fact that he's been able to kind of like grow out all of that hair right there, whereas we kind of saw a lot of the thinning areas, I would say that he is a good responder. And after 1 year of finasteride, he seems to be responding pretty well. And at the very minimum, he is able to even slow down or halt further progression of hair loss while also reaping the benefits of regrowth. So just the fact that he's been able to grow a lot of hair, I think if he were to kind of throw in minoxidil and the other treatments, he should be able to potentially see more regrowth. All right, next guy here is a 27-year-old male before treatment. You know, same typical hair loss in the frontal region and also the mid scalp and parts of the vertex. 1 year on finasteride, 1.25 milligrams per day, and Rogaine minoxidil solution 5%. And there's definitely a lot of improvement in terms of density right here. And you can kind of see a lot of the thinning areas on the kind of like the mid portion of the hairline. Over here, we obviously see a lot more thickness going on, and also kind of like that vertex area. So it seems like he is responding pretty well after just, you know, just 1 year of treatment. And I think this guy is also going to be requiring a hair transplant just because of the fact that he's been kind of receding for a while, in my opinion. And to really bring that down, he's gonna probably need maybe, I don't know, maybe like 2,000, 2,500 grafts to add in more density to establish a more natural looking hairline. Obviously, a pretty good transformation from how he was before. Now this next guy up here, 27-year-old male before treatment. You know, same thing, frontal hair loss going on. I don't think he has any vertex hair loss going on, but the doctor did kind of draw out a hairline as if he was going to proceed with a hair transplant. But for some reason, he decided not to. He said, or he probably said, let's give medication a try and see how that works out. And I feel like a lot of people that are looking into a hair transplant should really look into taking medication prior to getting a hair transplant, because a lot of people were able to reverse hair loss and potentially regrow a lot of hair, and therefore save a lot of grafts and money. So this guy, right before he decided to pull the trigger on a hair transplant, he took finasteride for a year and a half, and also Rogaine, and he was luckily able to regrow a lot of the hairs that have been miniaturized in the mid-scalp and also parts of the hairline. I think if he were to also use microneedling, he might see better results, but assuming that his results stay the same and basically he's been able to stabilize hair loss, he would need a small hair transplant procedure to kind of add in more density and thicken up the hairline, and also reestablish a more natural looking hairline that actually doesn't have any recession. So pretty good results. Now this next guy, 23-year-old male before treatment. So at 23 years old, he has seen some pretty drastic hair loss, probably on his way to like a Nord 7 eventually. And 1 year on finasteride, 1.25 milligrams per day with Rogaine solution 5%. He's been able to regrow a lot of his hair. His hair is obviously longer, so it's a little bit difficult to tell. But at the very least, he is able to stabilize hair loss. And it seems like he did see a little bit of growth because, you know, there's pretty good density here. And if you were to kind of grow out this hair, I think there would be a lot more patchy areas had he not been on treatment. But it seems like he is responding pretty well to finasteride. He would also, in my case, or in his case, I think we'll need a hair transplant later down the road to reestablish that hairline, and you know, decent results. Next guy, 34-year-old male before treatment, 1 year after increasing finasteride dosage from 1 milligram to 5 milligrams and adding minoxidil 5% solution. So his before photo, we see some of the typical temple recession going on, and also the mid-scalp and then crown area recession. And it's kind of weird because this guy's taking 1 milligram and then he started to take 5 milligrams. 1 milligram and 5 milligram in terms of efficacy as far as like blocking DHT really isn't that noticeable. So I don't know why he is increasing his dosage from 1 to 5, but he was able to kind of, I guess, regrow some of the hairs. It's a little bit difficult to tell also in his case, just because of the fact that he's been growing out his hair. But it seems like he has been responding in terms of just stabilizing hair loss. Nothing special, just because of the fact that he's kind of combing over that area, which would have been nice if he were to kind of keep it the same length as it was in here. But there's obvious improvement because there's no more miniaturization area here that as far as we can see. And this next guy, 47-year-old male. So this guy also has his hairline drawn as if he wanted to get a hair transplant, but he decided to give finasteride a try and Rogaine. So 5 years on said treatment, and he was able to regrow a lot of hair. So a lot of the miniaturized areas have now been filled with hair. A lot of good density, given his age. He could or he doesn't have to choose to get a hair transplant, but he seems to be a pretty good responder. Next guy here, 47 male before treatment. We can see some thinning areas on the temple region, on the frontal portion of the hairline, and also parts in the crown area where we can visually see right through the scalp. And then 1 year on finasteride, 1.25 milligrams per day. And we can see that his hairline has been reestablished. So pretty good results. And I feel like this guy has some really good, strong characteristics in terms of hair, just because of how thick it looks. And he's just been able to basically reverse hair loss. And as long as he is a good responder to finasteride, he likely is not going to need a hair transplant. Moving on, next guy, 35-year-old guy. Before treatment, a lot of the hair loss, thinning and miniaturization going on all throughout. Basically on the hairline, we kind of see where his hairline used to be, but a lot of the hairs have miniaturized, also mid-scalp and his vertex. And then 2 years on finasteride, 1 milligram, and Rogaine solution 5%. And we can now see a visible hairline that's been reestablished. A lot of the density that has been miniaturized is now filled with hair. And his hair length almost seems identical to how it was before. And it's pretty much day and night in terms of difference of growth. We can see that over here, there's a lot of areas that were lacking in hair. And then here, it's now filled in with a lot of good density. So this guy is a pretty good responder, but it still looks like he is still diffuse staining. And he might benefit from a hair transplant, although it's going to require a lot of grafts just because of the extensive nature of the miniaturized areas. But overall, I think he is a good responder, and kudos to him for seeing some pretty good growth. Next guy up, 27-year-old male before treatment, Caucasian. We can see some frontal hair loss going on, potentially some in the crown, and then 5 years on finasteride, 1.25 milligrams per day. We now see a much more healthy density on the mid-scalp. And it also kind of looks like his hairline has somewhat been reestablished, although this really isn't his hairline. It's kind of like the hairs that are covering it, but it sure is an improvement from how it was before. So, pretty good results for this guy as well. Next up is a 58-year-old male before treatment, and we see a lot of the diffuse pattern hair loss going on, kind of like that comb over that he's trying to achieve. And then 1 year on finasteride, 1.25 milligrams per day, and Rogaine solution 5%. We can obviously see a lot more density in terms of hair regrowth. And this is kind of like the same case where if he were to kind of grow out the hairs where he has right now, I don't think he would be able to achieve this prior to taking medication. And it just shows that even somebody who is almost 60 years old still care about hair. And he's just decided to go on finasteride and Rogaine, and I think he would be pretty content with the results so far. Next guy, another case of a 57-year-old male before treatment. We see a lot of the frontal and mid-scalp hair loss going on. And then after 3 years on finasteride, we can now see a lot more density improvement. It's not crazy to the point where he's not going to be needing a hair transplant, but given his age, I think he wouldn't most likely need a hair transplant unless he wanted to add more density. But it looks very natural, and it's obviously a huge improvement from where he was before. He could try minoxidil, like I said, and different treatments to see if he's going to respond better. But it looks like he is a good responder to finasteride, and he was able to save time and money from getting a hair transplant. Next up, 25-year-old male before treatment. Same type of hair loss going on in the frontal region. He's left with that island portion. And then 2 years and 3 months on finasteride, 1.25 milligrams per day. Rogaine 5%. This guy also has long hair, so it's a little bit difficult to see. But I think he has seen some pretty good growth. Although we can kind of see a little bit more thinning area here, as we've seen here. But, there's still a lot of improvement going on. And this guy is obviously doing kind of like a comb over to cover up his temporal recession. And we can also see kind of like that steep recession going on. But he does look like he did improve in terms of density. And this guy's also probably going to need a hair transplant to kind of fill in some of these areas on the temple region and then reestablish a natural looking hairline. Next guy up is a 27-year-old male before treatment. A lot of diffuse hair loss going on the mid-scalp. And then 2 years on finasteride, we can now see a much more fuller effect in terms of density. The hair is obviously longer, so it might be covering some of the areas. And we can kind of see a difference in terms of like recession here versus here. So I think a lot of the hair is covering some of the areas. But, at the very least, he is able to stabilize further hair loss because it doesn't look like his condition is worse from how it was before. And this guy, if he wanted to, I'd probably get a hair transplant if I were, in his shoes and just kind of reestablish and add more density to the frontal portion of the hairline. Next guy, 29-year-old male. We see some diffuse staining going on as well, and some pretty severe hair loss for somebody who is under 30 years of age. And then 1 year on finasteride, and we can see a lot of improvement in terms of regrowth on the mid-scalp and the hairline. Next guy here, 34-year-old male, same thing, hairline recession and some of the miniaturization going on the mid-scalp. And then 13 months on finasteride, 1.25 milligrams and Rogaine 5% solution. We can now see a much more fuller hair. This guy's been able to get a lot more density, I think, because we don't see any creases here in terms of hair loss. And over here, we can kind of see like that lack of density, and we can see right through his forehead Whereas the hairs here, it looks a lot more healthier, and obviously because of the fact that it has increased in density, he's able to kind of cover up a lot of the portion here, and his forehead is not visible. So pretty good results. We're down to the last few here. This guy here is a 45-year-old male, frontal hair loss going on, the mid-scalp recession, some of the temple recessions here. And then a year on finasteride, 1 milligram per day with Rogaine 5% solution. We can obviously see an improvement in density. And also, as far as the hairline is concerned, I think it's pretty much where it is before, but the areas behind the hairline has been reinforced with more density. So pretty good responder. Next guy, he has a much more severe case of hair loss going on for somebody who is 27. And then 13 months on finasteride, 1 milligram. We can see a drastic difference in terms of growth. And it's pretty crazy just to kind of see how much improvement that he's been seeing with just finasteride and Rogaine. And I guess he's probably not even going to need a hair transplant. And hopefully his hair loss is stabilized. Next guy up here, 30-year-old male before treatment. We can see some miniaturization going on to the hairline and also the mid-scalp and parts in the crown area. 14-month results while on finasteride and Rogaine solution 5%. We can kind of still see maybe a little bit more improvement in density to the mid-lock portion of his hairline and also this area here. Although his hair kind of still looks a little bit more wispy, and I think this guy, although he's been able to stabilize hair loss, he's most likely going to need a hair transplant to really add more density, but at least he is responding, and that's the main point of taking finasteride. And then finally, the last example that we have here is a 33-year-old male before treatment. We can see some pretty severe hair loss going on. There's no hairline at all. The mid-scalp is just thinning, and there's a vertex. There's a wide area that needs coverage. And then all of a sudden, 1 year on finasteride, we can see an improvement to his hairline and also an improvement to the density in terms of the mid-scalp and the crown area. It's obviously not perfect by any means, but he is most likely going to need to potentially use minoxidil to see if it's going to act as a positive growth agonist. And if he doesn't see any results with that, he can also resort to a hair transplant, because he does seem to be a good responder to finasteride, and then it looks like he also has some pretty good hair characteristics in terms of donor. So at the end of the day, it is highly recommended that those who are suffering from androgenetic alopecia take action quickly to slow the progression of hair loss through the use of finasteride at a bare minimum, and then supplement that with minoxidil. There's a lot of people, as you've seen in the examples, who were able to maintain their hairs from further hair loss, while some were able to also reap the benefits of regrowth through the use of finasteride and or minoxidil. You often hear about the big three that also incorporates Nizoral shampoo, which fights against dandruff, and there's anecdotal data that potentially shows that it acts as a mild anti-androgen. But ideally, you want to target hair loss from, just as many different mechanisms of action as possible, utilizing finasteride to inhibit the 5-alpha reductase enzyme, minoxidil to stimulate hair growth. We have microneedling or dermal rolling for growth factors, and even anti-androgens that some people use, such as RU5841 or CB0301, also known as Breezula, that target the androgen receptors itself. Unfortunately, there will be non-responders to finasteride because there are still residual amounts of DHT and spikes of testosterone that is unfortunately not accounted for. So if you're one of those non-responders, you really need to look into more than just finasteride. Especially if you want to stop hair loss in its tracks, and one of the best treatment options is to look into anti-androgens, like RU or CB0301, which is actually currently pending FDA approval. So that's pretty much it for this video, guys. Hope it's been educational. Let me know in the comments below if you have any questions. Thanks for watching, and I will talk to you guys in my next video. Take care.